This video includes general information about gastrostomy care. It is based on the standard material produced by the Unified Referral and Intake System. The gastrointestinal system can be divided into two parts, upper and lower. The upper tract is where nutrients are digested and absorbed. It includes the mouth, throat, esophagus, stomach, and small intestine. The lower tract is where water is reabsorbed and undigested food is consolidated into fecal waste. It includes the colon, rectum, and anus. A gastrostomy is a surgical opening into the stomach, called a stoma. A gastrostomy tube is a small soft tube that is inserted through the stoma and into the stomach. A balloon is inflated in the stomach to keep the tube in place. It has a round tip with holes on the end where liquid food and water can enter the stomach. A gastrostomy tube may be used when the child has difficulty swallowing, there is a risk of choking, the child cannot eat or drink by mouth, or the child cannot eat enough food or drink enough fluids by mouth to meet their nutritional needs. There are two types of gastrostomy tubes. The balloon gastrostomy tube has a disc that sits against the surface of the skin. It has two ports, one for liquid food and water, the other for medication. The Mickey low-profile gastrostomy tube has a button that sits against the surface of the skin. It requires an extension tube that locks into the button. There are two types of gastrostomy feeds. Bolus feeds are done a few times per day. They are given by feeding bag, syringe, or pump. Continuous feeds provide the feed at a steady rate for as many hours as needed. They are given by pump. Washing your hands is one of the most important steps when providing gastrostomy care. The child should be in a sitting position during a gastrostomy feed. The gastrostomy tube should be flushed with water before and after the feed. This prevents the tube from getting blocked. This video shows how to give a gastrostomy feed using a pump.
I will show you how to give a feeding through a low-profile button type of G-tube. An extension set is needed with this type of tube. I will be using a Kangaroo Joey pump in this video. Your child may not have this pump. Gather your supplies: feeding pump, formula, feeding bag, extension set if your child has a button tube, syringe, and water for a flush at the end of feeding. Depending upon the age of your child, this will most likely be 5 to 10 mL. Wash your hands. If there is a clamp on the feeding bag, be sure it is clamped. Hang the bag on the pole. Pour the prescribed amount of formula into the bag. Turn on the pump. Load the tubing by opening the door and wrapping the tubing around the rotor. Close the door. The tubing will need to be primed, which allows the pump to push the formula through the whole tubing. Program the pump to deliver the formula at a specific rate and volume. Put your child in an upright position if possible. If your child has a button tube, attach the extension set with the clamp closed. Attach the feeding tubing to your child's feeding port. Unclamp the G-tube or extension set. Start the feeding on the pump. After the feeding is done, stop the pump. Some children will need extra water. Your child's doctor or dietitian will let you know if extra water is needed. Put the recommended water into the bag. Set the pump volume and rate to give the water. After the water is given, clamp the G-tube. If your child does not require extra water, the G-tube will need to be flushed. This will keep residue from building up in the G-tube. Follow these steps for a water flush. Clamp the tube. Attach a syringe filled with 5 to 10 ml of water to the feeding port. Unclamp the G-tube. Push the water into the tube. Clamp the tube. Remove the extension set. Be sure to wash the supplies when done with warm soapy water.
Aspiration occurs when food or fluid back up into the esophagus or mouth and is breathed into the lungs. It is an emergency situation. Signs of aspiration include faster breathing, nasal flaring, chest sucking in, wheezing or noisy breathing, grayish or bluish lips, mouth, or nails. If the child shows any of these signs, stop the feed immediately. If symptoms continue after the feeding has stopped, call 911. Notify the parent. Stay with the child until paramedics arrive. If the gastrostomy tube falls out, it needs to be replaced within 1 to 2 hours to keep the stoma from closing. Cover the stoma with a dry dressing and tape in place. Call parent immediately. If you are not able to reach the parent within 10 to 15 minutes, call 911. Do not reinsert the gastrostomy tube. If the child gags or vomits during the feed, stop the feed immediately. Position the child so that vomit drains from their mouth to prevent choking. When the child has recovered, start the feed again at a slower rate. Vomiting can be caused by the feed going into the stomach too quickly. If the child starts to vomit again, stop the feed and call the parent. If the child is nauseous or has cramping during the feed, stop the feed. Check the rate of the feed as it may need to be decreased. Check the temperature of the liquid food as it may be too cold. It should be at room temperature. Ensure there is no air running in with the feed, as this can cause gas. Start the feed again. If the child continues to be nauseous or has cramping, stop the feed and call the parent. A blocked gastrostomy tube may occur if there are kinks in the tube, not enough flushing of the tube, or thick fluid. Make sure the tube is not kinked or twisted. Attach a syringe into the tube and slowly draw back on the plunger. If this does not work, gently push up to 10 milliliters of warm water through the tube. If this does not clear the tube, call the parent. If the button or disc is not flush with the skin, the balloon in the stomach may be deflated. This can cause the tube to fall out of the stoma. Check the position of the gastrostomy tube by gently pulling on the button or disc to make sure the balloon is against the stomach wall. If the button or disc becomes flush with the skin, the feed can be given. If the button or disc is not flush with the skin, call the parent. Do not give the feed. If the gastrostomy tube falls out of the stoma, contact the parent immediately. If you cannot reach the parent within 10 to 15 minutes, call 911. Gas buildup can happen when air enters the stomach during the feed. This can be prevented by making sure the tube is filled with water before starting the feed. Position the child upright during the feed. If the child is uncomfortable or bloated, attach a large syringe without the plunger into the tube and open the clamp. Hold the syringe above the stomach for 10 to 15 minutes to let air out of the stomach. The child may have a skin infection at the stoma site if the skin around the stoma is red, swollen, a different color, or has an odor. Ensure the skin at the stoma site is clean and dry. If you see any of these symptoms, call the parent. The child may have a gastrointestinal infection if they have a fever, are nauseous or vomit between feeds, or have diarrhea. If the child shows any of these symptoms, call the parent. If food or water is leaking around the button or disc, stop the feed if the child is experiencing pain or discomfort. Make sure the stoma is clean and dry. Call the parent. If there is bleeding or drainage around the stoma, make sure the skin is clean and dry. If there is a lot of oozing, cut a small gauze in a Y formation and place between the skin and button or disc. Call the parent. It is important to keep the skin around the stoma clean and dry to prevent the skin from becoming infected. The stoma site should be cleaned if it is dirty or wet. This video shows how to clean a stoma site.
Your child's G-tube site should be cleaned at least daily. A G-tube site that is kept clean and dry is less likely to have skin issues. One of the first things that you'll need to do when cleaning the G-tube is to gather your supplies. Make sure you have a nice clean surface, that you have soap and water, Q-tips, gauze, washcloths, towels, anything that you might need to help dry the area. You'll also want to have any new dressings that you use to apply to the G-tube site when it's clean. The first thing that you'll want to do before cleaning the G-tube is wash your own hands with soap and water and dry your hands completely. You'll want to talk to your child about it's time to clean the G-tube. The next thing you want to do is remove any old dressings that were at the G-tube site. Once you remove the dressing, you'll want to look for any redness around the tube. You'll want to move the tube, look at the skin, look for any drainage, any crusting, and look for any excess skin tissue that may have developed at the site. After the dressing has been removed, you'll want to clean the site with warm soap and water. You can use your gauze pads that are soaked with the soap and water. You can use the washcloth. You can use the Q-tips to get under the tube and remove any of the crusting or any drainage that might be there. Get that. And you'll want to rinse all the soapy water off the G-tube. You want to use any extra Q-tips that you have to, again, get in there around the edge of the G-tube and remove any of the wetness from the water that may still be under the tube. Most children with G-tubes can take a regular bath or a shower to clean around their G-tube. Be sure to check with your doctor first before doing this. If a dressing is used at the G-tube site, you can now reapply a clean, dry dressing and re-secure the G-tube. Do not use ointments around the G-tube site unless directed by your doctor.
When cleaning gastrostomy equipment, ensure the sink is clean. Separate the equipment, such as syringe and extension tube, before washing. Wash with warm water and mild dish soap. Make sure all liquid has been removed. Rinse equipment with clear water until no soap or residue can be seen. You may need to rinse 3 to 4 times. Clear the water from the equipment as much as possible. Leave the equipment on a clean towel to air dry. Store in a clean and labeled container in the fridge. The feeding bag is replaced weekly. The extension tube is replaced monthly. The syringe is replaced monthly or when the plunger begins to stick and does not slide easily. Equipment should also be replaced if it does not appear clean after washing and rinsing thoroughly. Always check the expiry date of formula before use. Do not use formula after it has expired. Wipe the outside of the can with a clean damp cloth before opening. Formula should be used within 4 hours after pouring it into the bag. Unused formula that remains in the can must be stored in the fridge and used within 24 hours. Cover the opened can with plastic wrap or store in a clean sealed container. Label it with the date and time. When using liquid food stored in the fridge, remove from the fridge 15 to 20 minutes before the feed to bring it to room temperature. You can also place it in a container of warm water. Do not use the microwave to heat liquid food, as it can break down the proteins.